Hello and welcome everyone. I am Fernando Cervantes, Sharp Instructional Designer, and I will be narrating Writing a Practice Gap Statement, a Sharp CME Faculty Development Series E-Module. The purpose of this education is to provide a framework for CME and CPE faculty that uses current practice, desired practice, and metrics to design a well-developed practice gap statement using two basic structures. Following this activity, participants should be able to identify two basic practice gap statement structures, compose a well-constructed practice gap statement, and summarize the connection between current practice, desired practice, practice gap, and learning objectives. This is just a reminder that both the Accredited Council for Continuing Medical Education, ACCME, and the Accreditation Council for Pharmacy Education, ACPE, look for practice gap statements to measure the effectiveness of accredited continuing education. So what is a practice gap? Simply put, it is the difference between current practice and best practice or desired practice. A little clarification before we get started, practice gap and needs assessment can be used interchangeably. Desired practice and expected outcomes are also used interchangeably. For the purposes of this e-module, we will be using the terms practice gap and desired outcomes. Here's an example of how to identify a practice gap. As can be seen, we start by observing the current practice. In this example, the current practice is as follows. Currently, about 1/4 of patients with clinically probable Parkinson's disease do not actually have the disease, and about 21% of patients incorrectly diagnosed with another movement disorder have Parkinson's disease. Next, we need to determine the desired practice. In this example, the desired practice is as follows. Physicians will reduce the Parkinson's disease misdiagnosis by a rate of 5% over the next 12 months by employing evidence-based screening strategies. Finally, to identify the practice gap, we just need to look at the difference between the current state and desired state. In this case, the practice gap will be physicians require additional skills in recognizing the signs of early Parkinson's disease, as well as increased utilization of effective screening tools in order to improve the accuracy of the diagnosis. Now that we've reviewed what a practice gap is, we can go over how to construct a practice gap statement for your CME CPE activity request. We will be going over two basic structures. These are by no means the only ways to state a practice gap. However, they are solid frameworks to build on. Structure 1 works well for education with metrics and measurable outcomes. Structure 2 works well for prospective and retrospective education, for example, case reviews, tumor boards, etc. Basic Structure 1. Following the Parkinson's disease example discussed previously, we can construct our practice gap statement as follows. As can be seen, I've placed my current state, desired state, and purpose in sentence form and added a couple of transition words to the beginning of each statement. It is also important to remember that this basic structure includes metrics and a timeline. By combining our current state, desired state, purpose, transition phrases at the beginning of each sentence, our metrics and timeline, we get the practice gap statement you see on the screen. Basic Structure 2. This structure is ideal for prospective and retrospective case reviews. For this structure, you can start by listing the type or name of the activity, the intervention taking place in relation to current state or identified gap, and finally, the desired outcome. For example, this tumor board is designed to review existing cases and apply the most current evidence-based knowledge and guidelines in order to establish treatment plans for improved patient outcomes. Now that we have reviewed how to write a practice gap statement, we can make the connection between our practice gap and learning objectives. From the example we used earlier, we are going to identify learning objectives. As can be seen from our practice gap, physicians require additional skills in recognizing the signs of early Parkinson's disease. This can be stated as a learning objective in the form of distinguishing early Parkinson's disease from other Parkinsonian syndromes. Next, we can also see that physicians need to increase the utilization of effective screening tools in order to improve the accuracy of the diagnosis. This can also be stated as a learning objective as follows. Describe the most effective evidence-based Parkinson's disease screening and diagnostic tools. If you would like some more quick tips on writing learning objectives, please check out our Sharp CME Faculty Development e-modules and help sheets. Thank you for watching this e-module. We hope this information has been helpful. If you have feedback or suggestions on the content presented or content you would like to see, please email the Sharp CME department at cme@sharp.com. Thank you.